allergies are something that is very common nowadays. From dust to food, there are new types of allergies formed each and every day. So, doctor, what type of allergy cases do you get in your clinic? What is your general experience about allergies?
Mostly it's respiratory allergies, sneezing, coughing. These kind of allergies are mostly coming to the office generally. After that, this kind of food allergies, skin related allergies. Mostly, when you think about season wise, mostly allergies are coming to this kind of sneezing, throat ache, even continued as a fever. This is some general allergies in OPDs nowadays.
So, doctor, which type of allergy do you feel that is most problematic or it is difficult to cure?
Several kinds of allergies are coming in or encountering in daily practice. Based on the chronicity, actually, we cannot tell exactly which is so more problematic. That based on the patient's feeling and based on the other complication also. For example, allergic dermatitis. If it worsens or it is very chronic, it may be problematic for that patient, or it is associated with some other complications. For example, if a dermatitis case, he is having diabetic or any other autoimmune disorder, it may be complicated in due course. So we cannot tell exactly which is the most difficult to manage. That based on the symptoms and the complications, and also based on the patient's last one is chronicity. These all things actually.
More than this allergy, if a patient having neck pain, he's continuously sneezing, so neck pain will increase. So that's a different.
One will lead to another.
It is continue to other disease. So we have to manage sneezing is important for that cervical pain. So allergies is a very broad thing and a very serious thing.
So for example, this dust allergy, it's very tiresome. You cannot go anywhere without a handkerchief, or it just keeps on happening. 10-20 times people sneeze in one stretch. So what can we do for things like this?
Okay. In one sentence, we talk about this kind of problem. Allergic management, for example, dust allergy or sneezing, is not a serious issue for a doctor. It's not like a cancer, it's not like a surgery or something. But it's a serious, it's a annoying problem for the patient, because it actually gives a totally disturbs the whenever he goes for a job or he does something, it's actually annoying him. But basically for a doctor, simple, it's not a problem for a doctor to treat actually. So based on this dust allergy, for all the allergy, we have to develop a protocol based on the doshic involvement. Like in the Siddha and the Ayurveda, more or less we opt the same thing. We have a Vata Pitta classification for all allergic manifestation. As you told, the dust allergy is the causative agent. That may manifest in respiratory, or it may manifest in the skin. So, for example, somebody is just exposed to some dust. So, some may show respiratory or some may show itchy. So, based on that, we take the symptoms, categorize the symptoms, and we categorize under Vata Pitta Kapha. Okay, like that. So, this concept is similar in Siddha and Ayurveda. Because we treat based on the doshic theory. So, categorize the patient based on the doshas, then we develop a protocol.
To understand the patient, so sometimes this language is important. So, do the blood test, IgG test, and everything. You have to do it, and we educate the patient to confirm these things and educate and understand what to do, what not, what to do. Then only medicine comes. So medicine is a part, but his job is an important factor. Where he is living, that's an important factor. It's all contribute that disease. Then only we can give the medication. So educating the patient is important. That's the same thing.
Okay. So can you name some common medicines that we use?
So before that, in 2 or 3 sentences, I'll tell you the pathophysiology. That is the background. That's similar to based on that, the toxins which is producing in the body and the triggered immune mechanism, as doctor said, the IgE factor. So this triggered mechanism actually contributing in all the manifestations. So basically, as we discussed earlier, the doshic predominance is there, and also the concept of visha or toxins is also has to take in this scenario. So there we start with a detoxification methodology either by medicine or by purificatory therapies. As example, some other drug which we can reduce the toxins in the body in Ayurveda or Siddha. For example, in Ayurveda, the kashayams, classical medicines, kashayams like Nirmulya, Kamishhodini Gulika, but very good medicines in your thing like Avuri Churna. Avuri Churna is the best drug. All kind of like Neeli. We all know that Neeli is the wonderful Vishahara Dravya is used in some other yoga in Ayurveda and also in Siddha. Avuri Churna itself is a Vishahara drug. So based on that, we can start a Vishahara protocol. Because anyhow, the triggered mechanism is some toxins in the body. Okay. So in a Siddha and Ayurveda, what are the Vishahara Dravya based on the condition, based on the symptoms, we can start.
Basically, clear that kaba. So maybe it's infection or something. Clear it and restore with the another medicine. So two protocols is important. Clear that surface and restore that to back to normal. So two type of medicine you have to plan. Two category. No, that's also important to treat that patient's allergies. Generally for allergies, depends on where it affect. There is a definitely side is.
Maybe respiratory means after finishing the detoxifying method, we can concentrate the particular area. So there may be vata or kaba, maybe more in the respiratory. In skin, when it comes to the skin, maybe pitta and rakta dosham or the purification of blood is needed. So there the medicine changes. And also the prakriti will also take into account. Prakriti means the temperament of the body. For example, vata or pitta, kaba, what are the temperament? What are the habitat also it's one of the factors, as he told that. Because like where he situates and also now maybe in the discussion maybe there the diet also. So a very big role for the diet also. So maybe in your discussion that will also come, I think.
Yes, my next question was about
diet. Before that, AC is a factor.
Oh, air condition.
So it's not in our classical time in literature, but so it's also we have to 24 in an office, 8 hours in an AC office, and exposed again to atmosphere. Maybe it's all affected. Maybe a factor.
What he asked is about the medicine also. So these are the scenario or these are the pathophysiology and the contributing factors. Based on that only we select the disease, select the medicines. As we discussed the Churna way tool. The first method, first protocol is the detoxification, detoxifying the body through any medicines, either from Siddha or Ayurveda, because Santhigiri produces both medicines. So we used to combine the medicines. Later, we have a lot of cases. For example, some of the thing I'll tell you about the skin, like Gulcheti Kashayam, Shivanaramarata. Shivanaramarata is a wonderful drug in Siddha. And also Gopi Chandana we can add. And Avipatti Churnam, that's a wonderful drug. Both it detoxifies the body and also it reduces the pitta also, because as we discussed, pitta is a triggering factor. Manifestation may be respiratory with kaba, but like that drugs are there. And I think some drugs, pulmonary Tarpam is a wonderful drug in Siddha, and some other kind of drugs based on the manifestation. For example, like Dashmurakaratray, Melaganadi, the combination. And another drug, I think we forgot actually about our own product, Hridayamogini. It's a wonderful drug where I think after COVID, Santhigiri has produced Hridayamogini or manufactured Hridayamogini. Yeah, Solanum is another drug in the respiratory complaints. Hridayamogini works well in all kind of like this IgE pattern of respiratory complaints, where we have triggered IgE and respiratory complaints is there. Along with allergy, Hridayamogini is a wonderful drug. These are the general medicines which we can tell about the classical one. And Haridra Ganda, an Ayurvedic drug for skin manifestation. Haridra Ganda is a wonderful drug. The sloga itself says that it is Kandu Nashini. That means it reduces the itchy sensation. So these are the things which we can tell about the drug.
So in conclusion, we can say that Siddha and Ayurveda equally can control the effects of allergy to a very good extent. Right.
And also, have to have the diet restrictions also. Try to avoid the fast foods, toxic habits, like not toxic actually. Diet and lifestyle changes, proper diet plan, or proper dietetics actually. Dietetics, we call it as viridahara, like incompatible foodstuffs. And modern generation has to avoid to control the allergy, whatever it may be. In Siddha also it is there.
Same thing. It's kebab producing. To have avoid something kebab producing things like milk, curd. To extent. For the extent, we have to avoid that things.
Now, it is clear that from combining the concepts of both Siddha and Ayurveda, we can effectively manage allergies.